This is Selma Schimmel in Chicago for the group room. We're at the 2012 Multidisciplinary Symposium in Thoracic Oncology, which is brought to you by ASTRO, IASLC, ASCO, and the University of Chicago. And we are joined by Dr. Karen Reckamp, who's Associate Professor at the City of Hope Comprehensive Cancer Center, Duarte, California, obviously a medical oncologist.
Good to see you again, Selma.
It's great to see you again. And we're going to talk about your phase 2 lung cancer trial.
Today we presented some secondary analysis from our randomized phase 2 trial. We looked at a combination of high-dose celecoxib, which is the arthritis drug Celebrex, in combination with erlotinib or Tarceva, compared to erlotinib and placebo. And in our trial, we did not specifically select patients, though we're finding that it's important to select patients when we have these targeted therapies. We found an improvement in progression-free survival by 2 months, although it didn't reach statistical significance in the main trial. When we did these classifiers by something called VeriStrat, which looks at a blood test before you start your treatment, and it classifies somebody as whether they're good prognosis or poor prognosis for treatment with erlotinib. And when we looked at this within our study, we found that the VeriStrat classification, when patients had good classification, this was significantly improved and predictive of response and progression-free survival in the high-dose celecoxib and erlotinib arm. Most specifically in patients who don't have EGFR mutations. So those are the patients who don't always respond to this type of treatment with EGFR inhibitors. So I think it's important because this is in a wild-type population that is not specifically selected. It's a blood test that we can do before therapy and potentially predict for response with this new combination therapy.
How did you come to choose Celebrex? We've heard about Celebrex used in the colon cancer research. Tell me how it evolved into lung cancer.
COX-2, which is what Celebrex blocks, is widely expressed in multiple malignancies and pre-malignant states. So it's an important part of the development of cancer, especially lung cancer. And so many studies have looked at Celebrex in the development of multiple cancers. It's important in decreasing cancer growth or polyp growth in patients with familial types of colon cancer, and may have similar types of benefits for patients with lung cancer. In our hands, we found when patients already have established cancer, actually higher doses than the approved doses are necessary to block that cancer activity. And again, the selection component is also important. So whether by this blood test or potentially even a urine test that tests metabolites of the byproducts of the COX-2 pathway may be helpful in identifying patients with this active pathway that may help to fight their cancers.
Talk a bit about the evolution of the blood test itself.
So the VeriStrat blood test was established in 2005, and it's based on what we call MALDI-TOF, so it's a proteomic type of blood test looking at multiple proteins within the blood, either serum or plasma. And they established this protein profile. It's been locked since 2005, and then multiple studies have validated its use. It is still somewhat in research phases. It's available for use, but somewhat in research phases, and multiple prospective trials are ongoing to really establish its full place in lung cancer therapy.
And what happens the next step? Talk us through the next phase of your trial.
So the next step would be to look at this in a larger patient population, in a selected population, because as I mentioned, in the unselected patient population, we saw a trend, but not a significant improvement in patient progression-free survival. So in a selected population, and in specifically EGFR wild-type patients who don't have the usual benefit to Tarceva therapy, we would like to test this in combination with erlotinib, or potentially using one of the more novel second-generation pan-HER human epidermal growth factor inhibitors, and using the combination to see if we can improve progression-free survival and improve outcomes for patients.
Thank you so much. Dr. Karen Reckamp, Associate Professor, the City of Hope Comprehensive Cancer Center in Duarte, California.
Thank you, Selma.